Here's how we are actually doing compared to Southern California, where the situation is not good. Santa Clara County's test positivity rate is currently at 3%, while LA County a stark 6.4%. KPIX 5's Kenny Choi on what the surge could mean for Bay Area hospitals. Kenny?
Liz, generally speaking, the Bay Area counties are doing a lot better than the rest of the state. As far as hospitals are concerned in Northern California, we're not at that crisis level where there aren't enough ICU beds, but we still don't know when that third surge will end. That's why health officials are concerned and still preparing for the worst.
Hospitalizations have spiked across California by more than 81% over the last 14 days.
Definitely concerned because my parents definitely have a high risk rate right now. So I would be terrified and scared if they got sick.
Hospital systems are stretched. We know that. I talk to hospital system leaders many times a day to hear how things are going on the ground.
But the numbers aren't as bad in the Bay Area compared to counties like Los Angeles, where even outdoor dining has been shut down. For example, in Santa Clara County, there are 53 COVID-19 patients in the intensive care unit, occupying about 10% of the county's ICU beds.
Probably not a concern right now.
Across California, more than 1,500 COVID patients are hospitalized in the ICU, accounting for more than 41% of ICU COVID beds. But the total number of beds designated for COVID patients can change.
It sounds more alarming than it is. I'm not saying that we don't have a problem, but obviously we have this type of denominator. The numbers will look bigger, more impressive compared to what the actual crisis is.
We do know that we can bring on additional beds, not infinitely so, but many more than we have today because of our efforts to plan around surge. We have spaces identified in certain facilities that can be brought on.
Right now, I think that the health system is doing very well. There may be some hospitals that are pressed more than others.
Kenny, we saw the spike in hospitalizations in the summertime. How does that second surge compare to this third one that we're currently in?
So when we look at the data, you could see towards the end of July, there were more than 2,200 COVID patients in the ICU across California. Compare that to now, it's a little bit more than 1,500. But health officials are certainly concerned because we don't know when that surge is ending, and we are on that vertical upswing on that graph. And so we just don't know what that ICU number will look like in a few weeks. Liz?
All right, Kenny, thank you.